Assalamualaikum
warahmatullahi
wabarakatuh.
Hello everyone, my name is Izzati Paramadina, student ID number J500210026.
Hello everyone, my name is Berliana Izza. My student ID number J500210027.
Hello everyone, my name is Aida Balqis, student ID number J500210028.
Hello everyone, my name is Fidzol Birru Izza. My student ID number is J500210029.
Hello everyone, my name is Noval Mahensa. My student ID number is G500210030.
Hello everyone, my name is Dhia, Laila, student ID number J500210031. First, I will explain about the causes of type 1 diabetes. Type 1 diabetes, also known as insulin-dependent diabetes mellitus or IDDM, is caused by a lack of insulin secretion. Damage to pancreatic beta cells or diseases that impair insulin production can lead to type 1 diabetes. Viral infections or autoimmune disorders can cause pancreatic beta cell damage in many patients with type 1 diabetes. Although hereditary factors also play an important role in determining susceptibility beta cells to these disorders. In some cases, predisposition to hereditary factors can lead to beta cell degeneration, even in the absence of viral infection or autoimmune disorders. The onset of type 1 diabetes usually begins around the age of 14 in United States, and for this reason, it is often called juvenile diabetes mellitus. Type 1 diabetes can develop suddenly over days or weeks, with three main sequelae. 1. Elevated blood glucose levels, and 2. Increased use of fat as an energy source, and for the formation of cholesterol by the liver. And 3 is reduced protein in body tissues. Thank you.
Okay, type 2 of diabetes is contrast to type 1. Type 2 diabetes is associated with an increase in plasma insulin concentration as known as hyperinsulinemia. This occurs as an attempt to compensate by pancreatic beta cells for decreased tissue sensitivity to the metabolic effect of insulin, a condition known as insulin resistance. Decreased insulin sensitivity interferes with the use and storage of carbohydrate, which will increase blood sugar levels and stimulate increased insulin secretion as a compensatory effort. Insulin resistance is a part of series of disorders often referred to as the metabolic syndrome. Some features of the metabolic syndrome include 1. Obesity, especially accumulation of abdominal fat. 2. Insulin resistance. 3. Fasting hyperglycemia. 4. Lipid abnormalities such as an increase in blood triglyceride levels and decreased high-density lipoprotein cholesterol in the blood. And 5. Hypertension. All features of the metabolic syndrome are closely related to being overweight, especially to the accumulation of adipose tissue in the abdominal cavity around the visceral organ.
Okay, next for symptom of diabetes. So diabetes symptom vary depending on how much your blood sugar is elevated. Some people, especially those with pre-diabetes or type 2 diabetes, may sometimes not experience symptoms, especially like in type 1 of the sign diabetes, symptoms tend to come on quickly and be more severe. So about some of the signs and symptoms of type 1 diabetes and type 2 diabetes are increased thirst, frequent urination, extreme hunger, unexplained weight loss, presence of ketones in the urine, or ketones are byproduct of the breakdown of muscle and fat that happens when there's not enough available insulin. Next, a sign or symptom on diabetes type 1 and type 2 is fatigue, irritability, blurred vision, slow healing source, and the last is frequent infection, maybe like such as a gums or skin infection and vaginal infection. So, type 1 diabetes can develop at any age, though it often appears during childhood or adolescence. So, everyone has a chance to get the diabetes like type 1 or type 2 if they have a bad lifestyle or maybe like bad habit. So about type 2 diabetes, the more common type can develop at any age, thought it's more common in people older than 40. Thank you.
Treatment for type 1 diabetes involves insulin injection or the use of an insulin pump, frequent blood sugar checks, and carbohydrate counting. Treatment of type 2 diabetes primarily involves lifestyle change, monitoring of your blood sugar, along with diabetes medication, insulin, or both. Number 1, nutrition and meal timing for diabetes. Eating a balanced diet is vital for people who have diabetes, so work with doctor or dietitian to set up a menu plan. If you have type 1 diabetes, the timing of your insulin dosage is determined by activity and diet. When you eat and how much you eat are just important as what you eat. Usually, doctors recommend 3 small meals and 3 to 4 snacks every day to maintain the proper balance between sugar and insulin in the blood. A healthy balance of carbohydrates, protein, and fats is your diet will help keep your blood glucose on target. How much of it will depend on many factors, including your weight and your personal preference. Watching your carbohydrates, knowing how much you need and how many you are eating is key to blood sugar control. Number 2, physical activity. Everyone needs regular aerobic exercise, and people who have diabetes are not exception. Exercise lower their blood sugar level by moving sugar into their cells, where it's used for energy. Exercise also increase their sensitivity to insulin, which means their body needs to release insulin to transport sugar to their cells. Aim for at least 30 minutes or more of aerobic exercise most day of the week, or at least 150 minutes of moderate physical activity a week. Both of activity can be as brief as 10 minutes 3 times a day. If the patient have not been active for a while, start slowly and build up gradually. It's also a good idea to avoid sitting for too long and to get up and move if the patient been sitting for more than 30 minutes. Thank you.
Okay, so number 3 of the treatment is monitoring your blood sugar. Also, so depending on the treatment plan, people with diabetes may check and record their blood sugar as many as 4 times as a day or more often if they are taking insulin. Careful monitoring is the only way to make sure that their blood sugar level remains within their target range. People with type 2 diabetes who are not taking insulin generally check their blood sugar much less frequently. So number 4 is insulin. People with type 1 diabetes need insulin therapy to survive. Many people with type 2 diabetes or gestational diabetes also need insulin therapy. Many types of insulin are available, including short-acting or regular insulin, rapid-acting insulin, long-acting insulin, and intermediate options. Number 5 is transplantation. In some people who have type 1 diabetes, a pancreas transplant may be an option. Islet transplant are being studied as well. With a successful pancreas transplant, people who have diabetes would no longer need insulin therapy, but transplants are not always successful, and this procedure poses serious risk. Number 6, bariatric surgery, also called weight loss surgery or metabolic surgery. Bariatric surgery may help some people with obesity and type 2 diabetes lose a large amount of weight and regain normal blood glucose levels. Some people with diabetes may no longer need their diabetes medicine after bariatric surgery. Recent research suggests that weight loss surgery also may help improve blood glucose control in people with type 1 diabetes who are obese. And lifestyle changes for diabetes is take care of your teeth, reduce stress, quit smoking, and cut back on alcohol.
So for the prevention of diabetes, this can be done by first mentioning the ideal weight with a diet of low fat. Second, consume high fiber foods such as fruits and vegetables. Third, reduce consumption of foods and sugary drinks. Four, exercise regularly and engage in a lot of cycle activity. Five, reduce sightings in silence for too long, like watching televisions. And the last, avoiding or avoiding smoking.
Thank you.
Thank you.
Thank you.
Assalamualaikum warahmatullahi
Assalamualaikum warahmatullahi
wabarakatuh.
wabarakatuh.